everyone. Welcome. Welcome to our Functional Neurological Disorders series. And today is the introductory series, session number 1. So I'm going to explain an overview of what we're going to be discussing during the course. During the 4 sessions, what we're going to be discussing today, it's what is functional neurological disorders, and we'll talk about how it is a spectrum between having one manifestation randomly that went away to having like chronic daily discomfort and symptoms. Then we're going to talk about the classification, the nomenclature, the names that have been given to this condition throughout history. And then what is the most representative name nowadays. So that's, we're going to discuss that today. And after each session, each recorded session, we're going to talk a little bit about, okay, what I presented today, what I present each time, what does it mean for each one of you? And what practices you can do during the upcoming days, and then during the live session, we're going to be learning together and integrating everything. The next session, we're going to review frequency, how frequent is the condition, so epidemiological data, and so important, why does it happen? What do we know about the causes and the mechanism that produces it? In session 3, we're going to talk about how is the diagnosis made and why is it underdiagnosed and underrecognized? What are the society and healthcare limitations that are affecting each one of you in terms of getting care and getting the diagnosis on time? And then during the final session, recorded session, I'm gonna introduce how you can heal yourself with science and shamanism, and how can you all care for the 4 universal bodies. So I'm going to be introducing the shamanic method and interface with science, and how these can truly be healing for you all and empowering. So let's start with the session today. What is functional neurological disorders? Well, as the name says it, functional neurological disorder, it means that the nervous system, and the nervous system goes from the brain, the spinal cord, the nerves, the junction between the nerves and the muscles, and then the muscle functioning also is part of the nervous system. So it's a disorder, is a problem in the way the whole nervous system is functioning. And of course, the nervous system, and it can manifest like various people will have different manifestations in different parts of the nervous system. And of course, the nervous system controls everything that we do. Our movements, our energy level, it has some influence in that. Our thoughts, our feelings, our sensations, our senses, vision and hearing and speech. It controls everything that the body does. So it's a disease of the nervous system that affects its functioning. It does not affect the anatomy of the organ. It does not affect the structure of any part of the nervous system. And that's why it has been so challenging to diagnose it. And it is because when the doctors do the test is normal. Of course, the test is looking at the organs, at the anatomy of the organs, for the most part, and the blood, and is looking for any problem in the various organs, and that is normal. And So this is a list of all the symptoms it can give, right? Like from um, it can give weakness and sometimes paralysis. Sometimes it can be fatigue, lack of energy. It can give all sorts of sensation symptoms or manifestations, numbness, tingling, pins and needles, pressure-like feeling, you name it. Really, any sensation difference that you feel that is not normal. It can affect coordination, can give tremor, it can give tics. Sometimes it can give certain movements similar to Parkinson's disease. It can affect the walking. Like I'm using a little bit of medical terms here to kind of create a bridge between medical terminology and more popular language. So functional gait disorders would be like problems walking, the non-epileptic seizures, right? Could be like shaking, and seizures, the seizures that happen from the functional neurological disorder group. They can be like sensations, like you're gonna have a seizure. It can be like actually the doctor can see the shaking and certain manifestations that can resemble the seizures that happen from an ill brain tissue. Sometimes it can be so severe that patients can go into coma. It can give visual disturbances. It can affect the movements of the eyes, the movements of the face and the tongue, the hearing, the speech, the voice, quality. It can affect swallowing. It can affect memory. It can give a more chronic feeling and sensation that the memory is not working well, and it can be more episodic, like having an amnesia event. It can give dizziness. It can affect the neurological system, and it can even happen in children.